And I say, desire is so unique, like fingerprints, right? It's like, how's your health? How are your hormones? How's the relationship, right? And so many, what we do with female desire specifically is we hold a bar at where the male partner is, and then she revolves around his desire. We normalize the male as what the desire should be, which once you see that, you're like, oh, wow. So her desire is often too low or too high compared to where we say his is the perfect one.
Wow.
So I love blowing that up a little bit. And then to think, the sex therapists are the ones who taught me is desire is a couple's issue. This is not one person's issue. It's what amount of sex is good for the relationship. And what do people get out of sex, right? That's why it's so cool to talk about. Is like, do you know why your partner likes having sex? Is it a stress relief? It's how I know I'm loved. It's how I feel safe. It's how I feel connected, right? It's like they might even be wanting sex a different amount of times because they're getting different things out of it and you have no idea.
And also, we don't have that language. I treat children and adults, and a lot of times when a child is exhibiting, curiosity about sex, a parent is like, can I meet with you? Because I don't know what to do. And many times you learn that, I learned that it's a cultural issue. In some cultures, their parents didn't talk about it, and it was something that you just learned eventually. It's something that if you talked about it when you were younger, you were considered rude or disrespectful or dirty. And there's a lot of psychoeducation there with younger children. But also what I'm finding in my practice is that children are learning about sex in areas where they probably shouldn't be learning about it. So a child will share porn. And I, when I meet with the families, I'm not like, porn is bad. I say, listen, porn is out there and porn can be positive for some and negative for others, but it's not for kids because children need to learn about sex in a safe environment from people that they can ask questions to and not learn it in an unregulated environment where they could possibly have damaging images imprinted. And I've had those cases where I had to treat a young child with cognitive behavioral therapy and exposure therapy because they just had a lot of anxiety about what they saw. But I do see a lot of shame from a cultural lens. And how do you address that from a culturally competent point of view when you're having patients in your office who don't have that language? They were never taught how to talk about sex. It just was something that you're supposed to figure out. How do you deal with that from a culturally competent point of view?
It's such an important topic. So I tell parents that your kids are going to learn about sex. They are inherently curious. If they don't learn about sex from you, they will be learning about sex from the internet more than likely. So it's like their interest is going to find ways to learn. Wouldn't we rather us be the one? And how I talk to parents is think of what your family values are. And how can you incorporate your values into the discussion about what healthy bodies are, what healthy relationships are, what are our values and how can they be fulfilled? And it's age appropriate, right? When they're really young, you just want to talk about body parts. That all body parts are healthy and they're good, and some body parts make us feel good, and that can be a gift, right? And what our boundaries are is also very important. And then as they get older, you can give them more and more details. But I think so many parents, they're so stressed because they're like, I need to know everything and I don't have the answers. And some of the most amazing conversations can be like, I don't know the answer to that question, but I'm going to find out and let's come back and I'll tell you what I've learned.
And share a goofy story. Like when I was a kid, this is what I did. Oops. Like I wish I had these conversations. I'm so glad that this is happening right now. You're decreasing the stigma and the shame and you're encouraging curiosity because they're going to learn it. They may not learn it from you, but they're going to learn it somewhere, right?